All right, well, thank you very much for joining this afternoon. We're happy to be here. What we're going to be walking through here is at the Interoperability Showcase is some of the technology and the workflow that we probably all talk about, but we don't ever get an opportunity to see some of the technology in action. So what we're showing here is some of the integration and interoperable solutions that we have between BD, Epic, and our Codonic safe labeling system. So what we're going to walk you through here is really what the experience is like during the pre-op care, the interop care, and then some of that post-op care and activity that's gone into taking care of our patient. Our patient is Pamela Richards. She's a 67-year-old woman that's come in for a heart valve transplant. So we're going to start that off, and all this is beginning, and the workflow begins within Epic. So I'm going to turn it over to Brian and let him walk you through how that workflow starts.
So in Epic, as a scheduler, either the day before surgery or the morning of, we would come in, create a case for the patient. As we create a case for the patient, we would schedule this particular procedure, and with this procedure, we would have a default list of supplies that are normally used for this procedure. You can see that default list up on the screen now. You can adjust this as needed and tweak any numbers if we need more supplies as well. As we actually go to schedule this case into an OR, we can send this information directly to BD so that they have the same list of supplies that we've requested in Epic in their supply cabinet.
So there's a lot of work that goes into the planning and knowing what's going to be done during that procedure. When the nurse comes in, we have the clinician comes in, we have Pyxis supply cabinets that are located throughout the pharmacy. Within these cabinets, this is where we have the supplies necessary for this particular procedure. As you can see, we've already started the case, but there is a workflow in which they would go in to identify and select that case. But what happens is you can see that the locations within the cabinet of the supplies that we need to pull are identified clearly for that clinician to begin pulling. When I open it and I identify what I need, in this case, dressing, I'm going to pull that dressing out of the device, and there's a button here or here that you can see, and this allows me to press how many of the item I'm taking. So if I'm going to take 3, I'm going to count those 3, I'm going to close it, and I'm going to begin pulling the other supplies from the Pyxis supply cabinet. That information flows back into the chart so that I know now what I've pulled in preparation for that procedure.
So during the procedure, as a scrub nurse or a circulator nurse, I can be logged into Epic looking at my intraop tools and see those same supplies that were pulled from the cabinet. Later on after the procedure, we continue to integrate with BD, and any supplies that aren't used and are returned to the cabinet can then be also communicated back to Epic so that we don't charge the patient for any supplies that we didn't use for the procedure.
Thanks, Brian. So that's sort of our pre-op care, right? The pre-op readiness, knowing and documenting where is necessary, as well as the ability to capture the charges, as well as managing our inventory on an ongoing basis. So now let's think about walking into the OR and the effort that's done to actually begin to start this procedure. The first thing that we want to start with is the medication and administration process. So what we're showing here is the Pyxis MedStation ES Anesthesia, and I'm going to turn it over to Greg, who's going to walk through PAS and our Codonic safe labeling system.
Thank you, Josh. So as Josh mentioned, this is the Pyxis Anesthesia Station. This is the Codonic safe label system. What an anesthesia provider will do is select the patient, Pamela Richards, and these are a list of medications that are already scheduled for this procedure. This is the Codonic safe label system that was designed to eliminate the 3 most common errors in the OR, which is a vial or ampule swap, a mislabeled syringe, or a syringe swap. And the way it works is pretty straightforward. Once the anesthesia provider selects the medications from the cart, they will scan this barcode. This barcode is the source of truth for this system. It contains a human-readable number as well as a machine-readable barcode. So the barcode will be scanned on the device.
Propofol, 10 milligrams per milliliter.
And that announces the name of the drug and the concentration. So by the time the anesthesia provider prepares the syringe, the label is printed, and this label contains all the elements required by the Joint Commission: the name of the drug, the concentration, the date and time prepared, the date and time expired, and who prepared it, in the color for that drug classification. Induction agents are yellow, narcotics are blue, all according to the ASA guidelines for medication labeling. In addition, we put a barcode on the label that can be scanned into Epic at the point of administration. And that barcode contains the exact NDC number from this vial that was basically thrown away after the anesthesia provider prepares the syringe. They discard this, so you need the barcode in order to scan at administration, and that's why we put it on the label. I'll scan another medication for you. We'll scan succinylcholine.
Succinylcholine, 20 milligrams per milliliter.
So again, that simple step addresses the two medication errors that commonly happen in the OR, and the third one is the syringe swap, and I'll turn it over to Mike, and he'll show you how we enter the medications into Epic at the time of administration.
Okay, thank you, Greg. So the next step is Pamela. They'll typically roll Pamela into the procedural area. Usually it's right near the gas machine. And on the gas machine, you're going to find two things. You're going to find the Epic screen, which is the anesthesia documentation system. And at this time, the syringes that were prepared at preparation are now moved to administration at the gas machine. So at the gas machine, we have the documentation system and we have a scanner. So as Greg mentioned earlier, the barcode that's on the syringe represents the parental vial that was thrown away. That's important for two reasons. I'm going to scan this into Epic and it's going to create the clinical documentation piece, but more importantly, and as important, that represents the NDC of the parental vial, which is important for charge capture. In the OR, it's very difficult to do that without capturing that barcode. So we're going to take it and we're going to scan it directly into Epic. So I'm ready, I'm the provider ready to administer it. I'll just scan it. So the first thing it's going to do is going to be an audio feedback. So I'm going to get a safety check even before I push it to the patient. Now I'll grab the port. I could either administer it at this point and then dose it, or I could just go to the next medication. So I'll grab the succinylcholine and I'm going to scan it.
Allergy, succinylcholine.
There's a warning. There's an allergy alert here. So I, as the provider, can take care of that or service that particular allergy alert, take care of that, and dose it later. So I have the ability to hear what's happening and be able to take care of it. And then at this point, I'll take care of that, and then I'll close out the case.
So as an anesthesiologist in Epic here, a couple things I do want to point out. I didn't really have to even look at the screen as I was going to administer those medications to the patient. I could scan them and get those audio readbacks to me to know this is the right drug that I'm giving to the patient, and I can tell whether the patient is allergic to the drug or not. Now, the beginning of the case is pretty busy. I don't have time to document this right now as to how much I gave of the medication, so I can easily close out of this and continue looking at whatever else I need to in the chart. Once the beginning of the case or later on has died down, or later on the case when it's died down, I can come back into Epic and it's saved 2 reminders for me for those medications. I can easily click the reminder and it will open up that medication to the same time that I scanned it in, and it'll indicate up here that it was scanned in. So now all I have to do is choose how much I actually gave and then close this out. Make sure that I can focus on the patient as I need to focus on the patient, but then also ensures that I have accurate documentation later.
Thanks, guys. So that was quite honestly probably the fastest heart valve transplant in the history of clinical care. So while our patient's out of surgery, there's a whole slew of activities that are done down in the pharmacy to prepare that post-care workflow, or to support that post-care workflow. As part of that, down in the pharmacy, for those of you that may not know, pharmacist's job is to manage those inventory of meds that exist within the anesthesia devices as well as the med systems. And so what we utilize is our health site data platform, which gives visibility to a variety of different data elements. In preparation or in support of this particular care, I'm going to turn it over to our pharmacist, Mike, who's going to walk us through what's the activities going down in the pharmacy to support Pamela's recovery in ICU.
Thank you. So what you see on the screen behind me here is a workflow view of IVs that are needed to be paired in the IV room. And this gives me a lot of great information. I can see what orders have come across and are ready for prepping, what orders are in prep, what orders are ready for checking by a pharmacist. I also have a listing of the patients And this particular view right now, I can see that I've got an opportunity here with some lab data that is coming in from Epic that is sharing some very critical information with me and whether or not I need to even have this medication compounded. So once I've kind of viewed this, I know that we've got, for Pamela, we've got an order coming in. It's for dobutamine. It's a medication that's not commercially available today. It's on back order, so we have to compound it. So we're going to so I can see that this is my IV workflow solution software where I can see that I have an order ready that I need to be preparing. I'm going to be preparing this medication today, or my technician is going to be preparing it today with our Pyxis IV prep solution. The Pyxis IV prep solution is comprised of this, what we call visual documentation hardware, this arm right here, which is a camera and a scanner, and it also has a scale, so we can gravimetrically or weighing the product to ensure that we get the right amount of medication into our bag in the finished bag. So the way the process works is that the order comes across into the IV prep workflow. The IV tech is in the IV hood. They grab their medication. They scan the barcode of the medication. They place it on the scale to get a weight. The scale will take a picture of that. That picture is important when it comes to pharmacists checking at the end of the process. The technician then places a syringe on the scale so that we can kind of get the dry weight. Then we can draw up the amount of dose needed, place that on the scale, weighing it each time, making sure we get the accurate medication in the syringe. If everything is good, I can proceed to the next step. If any part of this is incorrect, I am forced to stop and make that correction. So then once I've got the correct amount of drug, I can inject it into the bag. I place the bag on a scale. If everything is correct, I'll get a final label that the pharmacist then can sign off on and check, ready for the product to deliver. And I know based on the gravimetrics and the barcode scanning of the product, I have the right medication in the right amount for the patients to fulfill the order.
Thanks, Mike. So after we've gone through the build process of the medication, as Mike said, we have a label. So what we want to do then is similar to your Amazon order, we want to identify where this is in the process. So utilizing Pyxis Track and Deliver, we have the ability to scan the med, which identifies where it is in its transit. It's built, or where it is in. We have an ability to scan the medication to show where it is in the process of delivery. So what we're going to do is we're going to scan this drug. It's going to show that it's out for delivery, and then we're going to identify the location that we're going to give it. Now, this particular drug we wouldn't put in a cabinet. We may give to the actual nurse or clinician, or we may actually store in a refrigerator. We would scan that location. That information goes back into Epic, and so then the nurse, as they start their workflow to support the patient and the delivery of that medication is done back in the record. Brian?
Yeah, so now I'm an inpatient nurse in Epic. I'm looking at the medication report for this patient in Epic, and I see my dobutamine order. I want to go get that order. We can actually set up a menu, just a little button up here, where we can launch directly out into BD's application. So it'll take my username and password from Epic, log into their system with that, so I don't have to type anything in. It'll jump directly to the patient that I was looking at, and it'll pull in the orders as well, so I can jump to the orders that this patient has. When I'm in here, I can actually queue a medication, and also I can see where the medication is up here at that location. So I know where I can go get it, and I can queue it right here, which will save me time when I actually go to pick it up.
Yeah, so a critical part that we see is nurses know that the order is being prepared, but they have to know when to get it so they can give it at the best time. So in this case, they've already queued their meds up directly from Epic. So they're going to walk up to the cabinet. They've identified the location of the dobutamine. They're going to begin to remove other medications that they need. The Pyxis ES cabinet will open up. They'll be able to pull those meds, grab the meds that they're going to administer to the patient, go into the room and deliver those meds. This information also does populate back into the Epic chart so that they know that has been dispensed, and then they can begin to chart that administration. So hopefully you've had an opportunity to see how technology, how software, hardware, and process coming together can really make the life of our clinical users and champions better, as well as safer for the patient. So thank you very much for your time. We appreciate it.